From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
And welcome to this edition of Inside the 1581. I'm your host, Rich Rasmussen, and we are excited to have a conversation here about food insecurity in Oklahoma. And, you don't have to go very far to really look at who has been the leader, what organization has been the leader in addressing food insecurity. You don't have to go any farther than Feed the Children. And we're excited to have joining us today. We've got Julie Davis, who's the Senior Vice President of Strategic Partnerships and Individual Giving at Feed the Children, which is an internationally recognized organization that's headquartered here in Oklahoma City. And Julie, thanks for joining us today.
Well, thank you so much for having me. I really appreciate it.
So tell me, I know we're doing this remote, which is kind of fun. I mean, you're where you're at, and we're doing it through Zoom. And so hopefully the technology plays out really well. It gives us an opportunity too to extend the scope of guests that we can bring in. Why don't you tell us a little bit about Feed the Children, a little bit about your mission, and how you came to be located in Oklahoma City?
Sure. Happy to do that. Like you said, we are a leading anti-hunger nonprofit organization, and we really focus on delivering food and essential resources to children and family. And I say essential resources because that's one of our unique things that we do. We know in the U.S. that SNAP benefits don't cover things like shampoo and toothpaste and deodorant and feminine care products that families need so much. So by providing those items in addition to food, we're able to stretch families' dollars. So through the support of our generous donors, we are able to do all of those items that I just mentioned. And we also assist in times of disaster. And then you mentioned our international work, and we manage child-focused community development programs in 8 countries across Asia, Africa, and Latin America. Then on the U.S. side, I'm happy to share that last year we were able to support families through $400 million of shelf-stable food, essential household items, personal care products to children and family across the U.S. And we do that through 4 programs. So it's our resource rallies, our Backpack and Go program, our food and essential hubs, and then we also have Summer Feed and Read.
Now, you've got this program that's going on nationally. And so how do you fund all of this? I mean, this has to be an incredible amount of resources to be able to put into addressing this insecurity. How do you raise your funds for that?
We are so grateful for our really generous donors, both individuals and corporations. So many of our corporate partners give us product that we're able to distribute. And then the dollars that we raise really help us leverage that product. So oftentimes you'll hear us say every dollar you give helps us. It goes 9 times further, and that's because we're really able to leverage products from our very generous corporate partners.
Well, I know for all of that work, I mean, you're seeing the needs around the world, and oftentimes we say, well, what are the needs here? We identify needs. We can see them out our front windows sometimes. So what do you see in your evaluation of our state? The needs in our communities, and are they restricted just to urban communities, or are we seeing it in urban and our rural communities?
The data is just truly staggering. In Oklahoma as the state, 1 in 5 children are now estimated to be food insecure. And a recent report from the USDA estimates that a minimum of 250,000 Oklahoma households face food insecurity. We know that some other studies have shown that Oklahoma is the 3rd largest food insecurity state in the U.S. And Oklahoma County specifically is among the 10 highest counties in the US for food insecurity.
Oklahoma
So
City
that,
County?
uh-huh,
And am I correct that every one of our schools in the county qualifies for free and reduced school lunches too?
they do. And our data shows 150,000 residents use SNAP benefits within Oklahoma County. So we know the need is just so great locally. So we as an organization, as Feed the Children, have really been looking at how can we support our backyard? What is it that we could bring from the work that we do nationally and across those 8 countries, and what can we do to invest more here in our own backyard? So we have been working to do a landscape scan and see what's needed and see how we can collaborate locally. So I'm really excited about where that's going to take us.
Well, we're excited too. In our next episode, or our next segment, rather, we're going to talk to some of our hospitals and certainly the work that the Foundation for a Healthy Oklahoma is doing to promote efforts to reduce food insecurity. When you look at what is going on across our state, do you see any trends? I mean, are we trending in the right direction? Are we trending in the wrong direction? And are you hopeful for what we can do to perhaps continue to improve if we are improving?
The changing landscape, unfortunately, what we're seeing is it's getting worse. And so although inflation rates are supposed to be better and food costs are really remaining super high. I mean, we all see that when we go to the grocery store, right? So we really want to work locally, and what have been really actively doing is working to establish those 4 programs that I talked about earlier in Oklahoma City. So we want to bring those and see how we can support the areas of most need. So I'm excited to announce that we have an initiative called Feed Initiative Oklahoma City, and we will be kicking off a food and essential hub with the Oklahoma City public school system. We will be doing our summer feed and read program again, which I'm so excited. Last year we had such a great turnout, and we're able to support those kids who normally get their food during the school year, their lunches and breakfasts. We're working with local community partners to provide those shelf-stable meal kits for them to have, along with books and activities that they can do, so we don't have the summer slide. And then our flexible programs with the resource rallies, where we pass out 400 boxes of 25 pounds shelf-stable food. Those are really flexible. So we're going to find those portions of Oklahoma City where we can really have the biggest help and really help families with their immediate needs. And then sending kids back to school with backpacks is really important. We have meal kits in those, along with products to go back to the school year. So, I think it's something that through working together, through community partners, we can all try to really make a difference, because we want to end food insecurity for all children.
Absolutely. And we want to support you in that. And I know in our next segments, we're going to talk about what some work is being done by hospitals to address food insecurity. When you're delivering this and you're developing your partners, I'm sure that there are times when folks ask you this question: gosh, can you give us a story? Can you give us a story of where, we have had a family or an individual that's been helped by Feed the Children? Do you have one that you can share with us?
I do. And it's really pretty recently. We did a resource rally at the Oklahoma Indian Clinic, and we were able to visit with Scarlett, who is a single mom. And we oftentimes see those moms just giving everything they have. And so, she was sharing with us that she was expecting her 3rd daughter, that finances are really hard for her. And as a parent, she doesn't like the feeling of not being able to really have enough food on the table. And so she shared that the food was wonderful. And also, like I shared earlier, so many families need those essential items like toilet paper, cleaning supplies, and how that really was helpful to her family. So for moms like Scarlett, we really are just passionate about making a difference to reach these families so that she and her kids can have enough to eat.
That's so important, and when we look at the work of Feed the Children and others that are trying to address needs in our state, we often ask for people to donate their resources, but
Mhm.
clearly also donating their time is really important. If we just took five, right? If we took 5 minutes a day to do something that was contributing to the well-being of our state, what a better place we would be. And I would imagine there are great volunteer opportunities to help feed the children. I just kind of heard you tell us a little snippet about the Read and Feed. For our listeners, can you give us some examples? And then if there was a business organization, let's say a hospital, or another organization that might want to say, like the Oklahoma Hospital Association, we are willing to put time in and help. I know we worked with over the Christmas holidays and spent some volunteer time at the regional food bank. Are there areas where organizations or individuals could volunteer their time and their talents to support the work you're doing?
Absolutely. There's so many ways that we welcome the community to volunteer and be a part of our vital Feed the Children mission. So we have a distribution center right there here in Oklahoma City, and we love to have volunteers come and help us pack the boxes. So that's a great opportunity to really be a part of reaching these families through, we do about 30,000 boxes a year in food. So it's a lot of fun to kind of race and see how fast you can pack the boxes. But we also do volunteering at the resource rallies at all four of those programs that I mentioned. So we love, if anyone's interested, feel free to visit feedthechildren.volunteerhub.com, or you can contact our corporate partnership on our website, and we're happy to talk through all the different opportunities. We really are looking to collaborate in the community and see what we can do together. I will also mention coming up next week in Oklahoma, we'll be back at the Indian Clinic on March 28th. So if anyone wants to stop by, see what it's all about, see what it looks like. We love serving the 400 families, and we would welcome anyone to want to come by and see what it's about.
Well, that's wonderful. And we will go ahead and take that link and perhaps put it in a QR code so people can click it and look for that opportunity to volunteer and join in with Feed the Children. Julie, I just want to say thank you for joining us. This is our way of trying to bring attention to what is clearly a major need in our state, which is addressing food security. And certainly we can start with the children, but there are many families that go without food. And we know that for those who need health care, food is medicine in a lot of respects. And there's truly a return on our investment in investing in food and trying to tamp down on food security. So thank you. And thank you for the work that Feed the Children are doing internationally and certainly here in Oklahoma. So thanks for joining us. When we return to Inside the 1581 after our break here, we're going to have a conversation with part of the leadership team on health improvement at the Foundation for a Healthy Oklahoma. And we're going to learn what's going on in Duncan, Oklahoma with DRH Health as they work in their community to address food insecurity. Stick around for Inside the 1581. Looking to elevate your support services? Forefront Healthcare is a leading provider of food, environmental services, and facility management to hospitals all across the country, and was recently recognized as a 2023 Top 100 Best Places to Work by Modern Healthcare magazine. So to learn more about Forefront Healthcare and how they can help elevate your patient, staff, and family experience at your facility, visit forefronthealthcare.com or call 1-800-684-6450. Welcome back to Inside the 1581, and today we're continuing our conversation on food insecurity, and I am delighted to have two leaders in our state joining us on our show where we're going to dig a little bit deeper into what's going on in our state and certainly what are some of the solutions that we're seeing exercised in some of our communities. So joining me first is Greg Marshment. He is one of our health improvement leaders at the Foundation for a Healthy Oklahoma. And Greg, thanks for joining us.
Thank you, Rich.
And I know you have a real passion for addressing this issue. It has nothing to do with the fact that you have a nutrition background, right?
course
Of
not.
course not. Okay. Well, we're delighted to have you on our team here at the foundation, and you are leading this effort with hospitals across the state and our partnerships that we have in place. So, Greg, could you just tell us a little bit about yourself? What brought you to the foundation, and why you enjoy this work so much?
I have a background in health promotion with a specific interest in nutrition, obesity, childhood and youth health. And food insecurity initially for me was an issue for youth. I used to work with schools in Oklahoma City, and one of the primary needs, social needs in general were all very high, but food insecurity was something that was addressable at the school itself. And so I learned about partnerships throughout the state with the food bank or State Department of Health or Feed the Children that could help supply food to children that needed it. And in schools, there's certainly a stigma for many of the kids to receiving food or knowing that they need help. And it gets worse the older they get because they're much more aware of it. But that was kind of my foray into food insecurity and understanding the need in Oklahoma and what it can look like in terms of the actual person that has this need, the shame they might feel around it, the difficulty asking or talking about it, and how we could address that and destigmatize the need. So that was my foray into food insecurity. And in nutrition in general, Oklahoma's a huge need for support in weight management, obesity, and obesity-related disease. And that's been an interest of mine since I can remember. And so pursuing those interests kind of led me here to the foundation and leading our charge in food insecurity work and looking for these hospital partners that also understand the need, know what it looks like when patients present clinically with a need for food, and an immediate tangible need to address that.
Well, certainly we know, and just looking at some of the data points, that 14.5% of Oklahoma households are food insecure. I know growing up, my father passed away when I was young. My mom was a single mom, a widow, and I was on the school lunch program. And I knew that if I didn't have that school lunch, there may be times where I would struggle to make sure that I had that food that I needed, and certainly had the opportunity of breakfast too at that time. And we're taking this all the way back into the 70s and 80s. And I know that it had an impact on my ability to learn. And so to your question, when we think of kids, having them ready to learn when the teacher starts the classroom day, if they have a bellyache because they haven't eaten in a couple of days, it really does create a real disconnect in your ability to perform in the classroom. And so I appreciate the fact that you found that, and that was part of your passion for that going forward. So you are leading part of this work through the Foundation for Healthy Oklahoma. Tell me a little bit about what the foundation is doing in this space, and then later on we'll get into a conversation with Cyndi and what's going on in her community.
Absolutely. So the Foundation for Healthy Oklahoma is approaching food insecurity as a health-related social need. And we know our hospitals have an upcoming need to report on the 5 core health-related social needs. And food insecurity is maybe the most immediately addressable, tangible need out of the 5 core health-related social needs. And our work is looking to identify hospitals that are proactively implementing a screening process for these health-related social needs, hopefully partnering with either the regional or the Food Bank of Eastern Oklahoma to set up a food pantry on site to immediately provide food to patients that screen positive for food insecurity. And that's kind of our angle on it so far. And to any hospital currently listening, implementing a proactive screening process that you are very diligently and humanly trying to engage with patients on these subjects puts yourself in a position to address these needs. And that's kind of our primary focus in the hospitals that we're looking to work with around the health-related social needs in the Foundation for Healthy Oklahoma.
Well, it's really fascinating when you look at hospitals leaning into this issue. I mean, clearly it is a place where families come together right? They come together, whether it's a health screening for a young child, or it's that athletic physical that you receive before you start the school year, or it's where maybe mom comes for the first time for her mammogram, or any other primary care. It all starts at the hospital if it's not starting through a primary care physician. And so clearly we see benefits of the hospitals being in the middle of this. But what's unique about our work in Oklahoma is the fact that the Oklahoma Tobacco Settlement Endowment Trust, or TSET, is behind this and is putting resources behind it. Can you tell us a little bit about, their role in helping to fund this work?
Absolutely. So TSET, the Tobacco Settlement Endowment Trust, we have a long-standing partnership with them, and a primary focus for TSET is physical activity and nutrition. And they've been enormously supportive of our food insecurity work because they know the health-related social needs are an immediate concern in the state of Oklahoma, and many of them will have to be addressed before people can take more proactive steps towards physical activity and nutrition. There is no nutrition if you need food right now, for example. So TSET, we've had nothing but support from them, and I think that they and we want to expand our work and our partnership around food insecurity and into other nutrition-focused initiatives as well.
Well, clearly, there is somewhat of a nexus when we talk about our health, certainly screening out for tobacco and tobacco use, and making sure that we're replacing some of those habits really with good habits. And one of them certainly is good food choices and making sure we have availability of that. I was just looking at one of the other stats that I've looking at Hunger Free Oklahoma. It's interesting when you look at that. The hunger leads to low birth weight, delayed development, decreased language acquisition. Food insecurity weakens our labor force, decreases educational attainment, and increases healthcare costs to Oklahoma. So this is really an issue of ensuring that we can be competitive in a marketplace that's not just 50 states. I mean, it's worldwide when we're trying to grow our economy here, making sure that our employees and our residents and certainly our children are healthy. Is what it would seem to me. Greg, you've been working with some hospitals. I want you to tell us a little bit about those. I know you have some that are in line that have agreed to certain contracts to move forward. Tell us a little bit about that, and then we'll take a break and we'll come back and talk to Cyndi.
Absolutely. So one of our first partners is, of course, Duncan Regional Hospital Health.
DRH Health.
DRH Health.
There you go. Jay, if you're listening, DRH Health, we got you.
2 H's. They were one of our partners that really led the charge last year when we got into this, and I'm so happy that they are seeing success with it. But our lineup in the next few months is really looking promising as well, because we've got partners that are throughout the state. They cover some of they are very distant or distant enough from a metro area that some of that metro saturation of food support isn't very relevant for patients at these hospitals. So we are looking at Beaver County Hospital. They're very close, and they are very far from us here in any metro area. We've got Northeastern in Sallisaw, Northeastern Sequoia in Sallisaw.
Right.
We've got 2 Mercy locations near Ardmore, Mercy Hilton and Mercy Tishomingo, 2 very small hospitals that see, I think, a fairly high number of people that need food support. And looking at Cole County General Hospital, which Cole County General Hospital and Cole County as a whole is very, very high, similar to Stevens County, on need for food support. And so they were identified fairly early on in our process, and we're really excited that all 5 of those partners are pursuing this and coming on board fairly soon.
Well, that's exciting. I mean, when you think about it, we've truly bought into, food is healthcare. Food is good medicine. And so it's great to hear that hospitals are leaning in. And when we come back from our break, we're going to be joined by Cyndi Crook. She is with DRH Health, and she's going to talk to us and share with us what they are actually doing in the Duncan area and what they're doing not only to support the work in addressing food insecurity, but how this also rolls into the community benefit that they're providing to the people in the area. When we return from this episode of Inside the 1581.
Are you looking to elevate your facility's support services? Forefront Healthcare is a leading provider of food, environmental services, and facility management solutions to hospitals nationwide. Recently recognized in 2023 as a top 100 best places to work by Modern Healthcare magazine, our comprehensive boutique approach ensures measurable clinical outcomes tailored to your facility. Elevate your facility's patient, staff, and family experience today by visiting forefronthealthcare.com or call 800-684-6450.
Welcome back to Inside the 1581. I'm still joined here with Greg Marshment with the Foundation for a Healthy Oklahoma and also with Cyndi Crook from DRH Health. And we're going to dive in now a little bit with Cyndi and have some conversation with you about the work that is currently being done at DRH Health. Welcome.
Thank you. Glad to be here.
And you had a question for me.
I do.
Oh.
Why is this called the 1581 podcast?
Boy, that's kind of like a boom boom, right? Yeah. So inside the 1581 is we're trying to figure out what we're going to call our podcast. The importance of what we're doing here today is really telling stories about what is going on across our state, not only in healthcare. We may have stories that have no tie to healthcare, but they do talk about what's going on in a community that's important. So 1581 is the 1,581 miles of border in Oklahoma.
Oh.
So that's what we call it inside the 1581.
That's clever.
So
I
that's
like
what we
it.
do. And I give Alex, our producer, and Susie, our director of communications, all the credit because they put all this stuff together.
Kudos to you too.
So so we've got folks that are listening in. You know, we talked a little bit about food insecurity nationally with Feed the Children. We've been talking to Greg, and now we're in this part of our program. And I want to give you a chance to tell us a little bit about what DRH Health is doing in the Duncan area to address food insecurity. So I'll just open it up with that.
Okay, well, thank you. So where this really started with is we have a health equity committee. And of course, that's where we're looking
A
at.
committee of the board or just
It's
a community
committee of a hospital that I'm the chair of.
Okay, perfect.
And it's made up of all kinds of team members from representing different areas of the hospital. And they, we got together and we're looking at the drivers, food, transportation, ability to pay. And like Greg had said earlier, we looked at it and we go, which one of these could we make an impact on today? And we felt food. Transportation is a huge issue for us down in Southwest Oklahoma, but that is not something just DRH Health can tackle on our own. Sure. We need a lot of partners with that. So we did food, and so we started talking about setting up a food pantry. Well, Jody Franson, who works with me and is our director of quality, happened to be on a call where Greg was on the call and started talking about what you're doing up here. So Jody came to me and she said, "What do you think?" And I said, "Let's call Greg. We need to do this." So we had a call with them, and we set it up that we partnered with you guys, and we are so excited. So the way it works is right now we ask the driver questions to our inpatients. Okay. We're only doing inpatients at this time. If they answer positive that they're experiencing a food insecurity or unable to get food in the last couple of weeks, then they're turned over to a social worker or a discharge planner who goes into a little bit more detail with questions. Partnering with the food bank, there is a financial requirement that they have to meet, so that we do ask that question. They don't have to prove it. They just answer it. But if they meet the qualifications, then they get a box of food that we've received from the food bank.
So you're in doing this, you're addressing an immediate need of that patient, certainly. It creates additional opportunities for patient-family engagement.
Yes.
That's important, too. It also, we know that food, for example, when someone is discharged home, it contributes to better outcomes.
Oh,
we
definitely.
tend to don't see them come back to the hospital. So there's a win for everyone in this. And certainly if we looked at it from a payer perspective, whether it's a health plan or Medicaid or Medicare, ensuring that they don't come back into the hospital for readmission is certainly really important too.
Oh, definitely. And also, it's just good for the community. We want to take care of our patients. We want to take care of our community. We also provide them a food resource sheet. So it's with resources that are located in Stevens County. If they happen to be from Jefferson County, those are our two counties where our hospitals are at. We provide resource sheets for foods, resources that are there. Food Bank gives us resources for places up here in Oklahoma City, which, once again, I go back to transportation. They can't make it up here for those. But the other thing that we've done is we went ahead and set up a supplemental pantry. So we can also...
And that's in the building where you have where the nursing school as well,
Yes,
right?
right by
I think
my office.
I've been there before. It's
Oh.
wonderful what you guys have going on there.
Thank you.
I think that's another conversation about how our hospitals are leaning in on the workforce. And you
Oh,
guys are
yeah.
leaders in what's being done there.
We are. Yes, Lisa. It's a great work. So we set up a supplemental. We do food drives within our team members. We tell them what we want, specific items. So where that is expanded is we can either supplement the box that we're giving the inpatient, but we also have a cancer center on our campus. Now, I'm also the director of our foundation, and we supply gas cards to patients. Well, I open it up to food. So you have cancer patients that are obviously struggling. So we've been giving bags of food to our cancer patients. We don't screen them. We don't use the boxes we're getting from this program because you have to screen them. We're using our supplemental food. Now I have physicians that are calling me from clinics going, hey, I've got a patient that needs some food. No questions asked. We put a bag together, give them a resource sheet, and send them on their way. Our goal is to expand this to all our rural clinics down in Jefferson County, even in Cotton County, because we have a clinic in Cotton County and Walters. So that's our goal.
And I think it's so important because, if we kind of demystify a little bit about hunger, we know that 67% of those who are SNAP recipients are seniors, their children, and they're disabled. And so that leaves a whole lot of other people, too, that don't fall within that criteria that are still food insecure.
They are.
And I think we talked about this earlier, Greg, about the importance of having a strong, healthy, vibrant workforce. If we don't address this, then we know we have billions of dollars. Literally, again, I went back to the Hunger Free Oklahoma, $1.4 billion each year through increased illness and decreased academic achievement. If we don't have good food, folks aren't being fed, then we are not getting the kind of performance that we hope to get out of everybody.
It's true. Another program, I'm just going to elaborate, another program, though, that's not with this one we started, it was called Garden Fresh, and that's for our diabetes patients that...
that was going to be my next question. You
Yeah.
kind of connect the dots. We look at chronic conditions,
Yeah.
and here's a perfect one.
Yeah.
We know our number one or number two chronic condition is diabetes, and we line these things up, and we keep folks out of the hospital. So, tell us what you're doing.
Yeah, so physicians refer them to us, and if they have an A1C of 8 or higher, we have a Thinkability community garden, and they can go once a week and get $20 worth of free fruits and vegetables. We provide recipes, and our diabetes dietitian goes there, gives them recipes, gives them healthy hints on how to live better life. And then we have quarterly classes where our chef will cook healthy food for them, and we take their A1Cs. The foundation helped fund that through Pathways, and we've got about 10 participants. We're still growing, but
That's 10 participants. Hopefully, you keep out of the hospital.
Yes, and their A1Cs are going down.
Wonderful.
And so we're really excited about that one. And Thinkability is a great community garden where I would love to partner with them. My goal is that patients that receive a box through this program can also get maybe a $20 coupon to go to the community garden and get fresh fruits and vegetables. That's a goal I have. I'd love to get some freezers and be able to put bread, cheese. I'd love to get milk. The other thing we do, we've opened this up to our team members because you can still have a job and have food insecurity.
Sure.
So leaders can email me and say, I need some bags, no question asked. I don't want to know who. We'll give them a bag of food. It's
Greg,
a passion.
Greg, we need to put that on our list to see if we can find some folks that would be willing, some philanthropy to help incentivize some of this work with freezers. I think that's exciting. It's an example of right from farm to table, and certainly we've really narrow casted who benefits from this, which is significant. So when you look at this, Cyndi, you guys have now had success. You can demonstrate a return on the investment that your organization has made, and it's also an excellent testament to what you're doing to provide a community benefit to the people in your service area. What would you say to other hospitals? What would be some advice you would give to a hospital sitting back and saying, I don't know if I can do that? What would you suggest to them in terms of the steps moving forward so they can follow the lead and the kind of the template that DRH Health has created?
I think you need to find a champion that's willing to
And who is your champion?
me.
Okay, great. So you need someone who's invested. You got a passion for it.
It's a
clearly.
passion.
Absolutely.
You need to have your senior management.
Okay.
So, when we started with our committee, we as a committee came together with what we wanted to do, and then we went to our senior management and said, this is what we would like to do. And I have the best senior management, I'll just say that. And they're like, yes, do it. Do what you need to do. And but then don't think you have to do everything all at once. You can start very easily with, we started with inpatient and partnering with OHA, which has been a great partnership. And Greg's been great to work with and his team. If you wanted to start that way, or if you just want to do a food drive with some of your departments and do shelfable food and just start out that way, that's easy to do. I would recommend strongly, though, that you know your food resources in your community. Don't give them food without giving them resources where else they can go, but don't give them resources that are 60 miles away. Try to find the resources that you do have in your town, because you don't want to put another hardship on them.
Sure. Keep your healthcare and keep your food local.
Yeah.
Well, it's maybe a kind of a good way of looking at that.
Yeah.
Is there anything that, as you've gone through this journey, is there anything that you would do differently from what you've accomplished? Because you've got a year under your belt on this. Or maybe a better question is, how would you measure your success year to date? Maybe that's an easier question.
That's a tough one. I'm trying to think.
But you've had success.
We have had success.
Yeah.
Educating our team members more.
Okay.
That was really important, and we're still not done. We need to do that more. We had the protocols down. We had a great team that got together so we could put it in our EMR, to how our case managers.
Which we don't think about. That's a perfect example of a great learning lesson for others that are doing this, that you guys have identified a capability to do that.
Right.
And you use Meditech. And a lot of our rural hospitals use Meditech.
Yeah.
So that's been solved for. You've solved it for a bunch of them.
Yes.
Okay.
We fixed it, how to, who gets an email, I get an email. You have to have, and it's not just me, I've got some people that back me up, because what we do is we store the boxes in one area, but we take like 6 boxes over to our case managers. So if it's at night or on the weekend, they still have boxes available. You got to work out those logistics. We've done that. So working out the logistics and being okay if this is terrible. We always said that when the first time we gave a box away, I said, is it bad that we're excited that we gave a box away? But we just want to help people. So I think we've been a success because I've got a good core team that believe in it and want to see it succeed. I've got upper management that believe in it and want to succeed. And I think that's what makes it work, is a good team.
One last question. What has been the response from your community? I would assume there's kind of perhaps a buzz about the good work that you guys are doing.
Patients are very grateful.
Patients, okay.
We talk, sometimes it's embarrassing to admit that you need food.
Right.
So it's not as loud as you think it might be. But the feedback we do get from the patients and the families that do receive the boxes or the supplemental food, they're extremely, extremely grateful.
Well, clearly, you guys have tapped into a real need. You've responded to that need. You've demonstrated your benefit to the community for doing that. You're reducing healthcare costs. You're aligning this great work with chronic conditions. I think it's a model that every hospital should really look deep into in their organization, see how they can do it. And certainly, Greg, you guys have provided the leadership. You were the inspiration for helping to get DRH Healthcare going. And so we're just appreciative of both of you joining us in this edition of Inside the 5081. So thank you for being a part of this.
Thank you.
And again, as we close out today, I do want to extend a thank you to Alex Taylor, who is our producer of Inside the 1581. He not only makes the sound good, he also shoots the video for it, and what allows us to show that and display that both on our Cyrano platforms and on YouTube as well. Susie Wallace, our Director of Communications, again, she puts all this together, even has our cool mugs. We're going to make sure you get one when you leave, Cyndi, one of our cool mugs. Greg, you might have to wait until we order some more because they're very popular right now. But again, we want to thank you for that. And as we close out, as we did last week, we want to thank the the band Gunslinger, who has provided our music, Ends of the Earth, which is the theme song for Inside the 1581. So for everyone joining us today, we thank you. We hope next week or our next episode that we'll have another exciting group of folks to come in and join us as we talk about how we can collectively work together to improve health and healthcare in Oklahoma. Thank you.